The findings of a youth health and sexuality report conducted here in the British Virgin Islands in February 2012 has revealed alarming rates of premature sexual activities among minors in the society. Of the 1,609 in-school youth ages 11 to 19 targeted by the survey, 52% were females and 48% were males. 52% of all the children who took part in the survey were between the ages of 11 and 14, 34% ages 15 to 16, and 14% ages 17 to 19. 70% of the children were of Afro-Caribbean descent and 22% of mixed ethnicity. 72% lived with biological parents and 15% with step-parents. Among the startling results coming out of the study, it was revealed that boys are having sex from as early as age 9 and girls from ages 12 to 16 years. 61% of the young people who participated in the survey used a contraceptive when they first had sex, but this was much more popular among the females. According to the survey, generally 69% of girls were more likely to use contraceptives versus 53% of males. Of those who chose abstinence, 40% are waiting until they get older, while 30% said when they get married. The report says that the risk of contracting a sexually transmitted infection was not prominent among the reasons for abstinence. It says only 14% cited STIs as a factor. Health Minister Ronnie Skelton says the results of the survey have implications for the entire society.
Madam Speaker, the findings of the study are being shared with pastors, policymakers, legislators, teachers, parents, and other relevant stakeholders to enable development of the necessary strategies, interventions, policies, legislation, programs, and services to address the causes of adolescent health problems. Madam Speaker, the report has identified 17 specific recommendations to strengthen the territory's capacity towards improving awareness and promoting healthier lifestyle among young persons. These include strengthening existing programs and promoting healthy lifestyles and sexual and reproductive health, developing programs to strengthen relationship between parents and children, and establishing, reinforcing legislation and policies to better protect the health and the rights of young people. Madam Speaker, all of these initiatives require strengthening collaboration between the Ministry of Health and Social Development and the Ministry of Education and Culture. And my colleague minister and I are both strongly committed to achieving this. Work has already begun on a technical level to implement the recommendations of the report with assistance from the Pan American Health Organization.
Peer pressure is observed as one factor influencing early sex among BVI children, though not in all cases based on the survey. 51% of those surveyed who has close friends sexually debuted between ages 12 to 14. However, it is significant to note that 55% of the young persons who didn't have friends who were having sex had their first sex between ages 6 to 11 years. 51% of the respondents who started having sex from age 12 to 14 experienced problems at school. High depression levels were also recorded among those children who had their first sexual intercourse between ages 12 to 14 years. The Youth Health and Sexuality Study was developed with the technical support of the Pan American Health Organization and financial support from the European Commission through the regional project titled Strengthening the Integration of British and Dutch Overseas Caribbean Territories in the Regional Response to HIV.